Hello and welcome to my series Learn Radiology with Dr. Anil Joshi. The series has got multiple lectures for different capacities. Some are for residents, some are for the technologists, those who are doing medical imaging technologies, and some are those who are interested in radiology, particularly from the medical field. Now we got different lectures, different topics, now different capacities, so also extensiveness. The present series is for a simplified version of the radiophysics. Now different topics are covered, which are now first starting with disclosure. Most of the material which we are using is our own. However, some material we have downloaded from the web net which are royalty free, and we acknowledge with thanks from whom we have got this material. Now let's get going towards the X-ray film. Now as you know, the history of X-ray is very long, and what X-ray technique we are seeing, what films we are using, what film we are seeing or going to use in future are totally different than what it was. So let's get back to the historical aspect and see how the things were. Now photography began before X-rays were invented. In other words, photography was well established when X-rays were invented, and initially they have made use of the same thing. Now see how silver containing compound react with the light, making light image possible. Now more is the light, more is a blackening, less is a light, less is the blackening. Depending on that we get gray shades, and a photography is possible by using a visible light. Now these images could be made permanent with the treatment with certain chemicals. Now we have whatever we got today needs to be preserved for future. This phenomenon was applied to the X-ray procedures also. Let's see more. Let's go down to the historical aspects. In 1812, silhouettes were recorded on a glass plate. In 1819, the solvent action of the sodium thiosulfate on silver chloride was discovered and this phenomenon was used in X-ray films, and the discovery was by Louis Aguirre. Now 1 year later, it was discovered that treating exposed silver chloride paper with sodium chloride would make a permanent images, and that made a big revolution. By the time X-rays were discovered, photography was already an art. It was already established. Now film with nitrocellulose base were marketed by George Eastman. The first X-ray film was recorded on such glass plate only. These were coated with emulsion on one side only. Therefore, the exposure dose was used to be very high. The glass plates were used until World War I. Now during World War I, nitrocellulose-based films were found to be a more feasible choice for the recording X-rays. The films were single emulsion, single coated. It was later discovered that the double emulsion film respond to X-ray faster because of the double coating. The flaw with nitrocellulose-based film was its easy inflammability. So when you were storing the X-ray film in a large quantity, they were used to catch fire and destroy. In 1924, cellulose triacetate replaced the nitrocellulose-based films, what we popularly call as a polyester-based films. In 1960, the first medical radiographic film using a polyester base was introduced. Those who have seen both type of film will appreciate the polyester base is very clear, it is very transparent, and gives better contrast of the images. Now further going down the X-ray film, let's get now to the films which we used. Let's go to the introduction first. X-ray film are the most important material used to decode the information carried by the attenuation of X-ray beam. So whatever attenuation X-ray beam was undergoing in the body was recorded over the film, and when they are made to pass through the tissues, they had a different attenuations, and this different attenuation was reflected in turn in a different passage of the X-rays, and they created a different type of grayscale over the film. Now the capture invisible light into a visible form was a basic principle behind the X-ray films. Main part of X-ray film is the radiation sensitivity. More it is sensitive, it will require less radiation. Ultimately, a patient will be benefited. Photographically active material made in the form of emulsion coated on the supporting material was called as a base. So what we are talking about is the constituents of the X-ray film. It has got a base, and on that there was a emulsion. Then what are the types of film depending on these two? A single emulsion and a double emulsion. Then also based on the use of the screen, non-screen type of film, we are still using it in a dental practice. Then screen films may be a single screen or double screen. At most of the places it is replaced by CR and DR. Now based on the sensitivity, you can type the films as the blue sensitive, green sensitive, and panchromatic sensitive films. These you must know when you are designing a dark room, because safe light of the dark room will need all these informations. Now let us come to a radiographic film. If you see here carefully, there is a base which we said was nowadays it was a polyester when the films were last used. They were polyester based for advantage, clarity, non-inflammability, which we we have already seen. Then there was emulsion, which can be on either side, single coated or double coated, depending on the speed of film we want. Double coated film gives a better speed. To support the fragile photographic emulsion, you need a base. Now this is the micron thickness of the base. It should not be too thick, because it will otherwise decrease the transparency, and therefore films will not be as good. They will not give as good contrast. It should have both shades nicely, a white shade and a black shade. Then only it will look nice. Now, what are the requirements of film base? A clear with low light absorption, should not produce visible pattern on the radiograph. If the film start producing or the base start producing, the pattern on the X-ray film will be nowhere. It is very important that it should not produce. So it should not create any shadow. Now, strength, thickness and flexibility of the base must allow for easy development. That is, a post-processing film must have dimensional stability. That is, maintain size and shape during the processing, hardening and storage. And it should have low inflammability. How we achieved it? We changed from cellulose to polyester. That's why the inflammability was controlled. Now, what are the type of bases? Glass plate, as we have seen, was the earlier film used. Earlier, the glass plate was used. In the past, thin layers of emulsion, and nowhere it is used nowadays. Now, second was cellulose nitrate, used in 1914 till fairly recent, almost up to 2000. It was inflammable, but at same time it was available. Both types of film were available. That is one polyester base and also a cellulose base. Now, cellulose triacetate was accepted in 1924. The polyester adopted in 1960 for the better dimensional stability. It was a colorless, so it was not absorbing light. It was not casting any shadows. Then the constituency or the material which was used was dimethyl terephthalate, that is DMT, and ethylene glycol. These were the main thing used, and they are brought together under low pressure and high temperature to form a molten polyester, that is the stretch into the sheets. So that is the technological details how the films were produced. Now, tinted blue films, triacetate and polyester, are clear and colorless. Adapted in 1933, blue tint was added to the film in an effect to produce a film that was easier to look at. It was a clearer, sharper and a brighter. It caused less strain to the eyes. You can keep on reporting multiple X-rays at a stage. Then blue tint can be added to either base or to the emulsion, but at most of the time it was never added to the emulsion. It was at the base only. All present X-ray films are blue tinted, including the films which we are using for CR and DR also for printing. Now, emulsion. It is a phosphosensitive layer over the film, and the key ingredients are the gelatin and silver halides. Thickness not more than 0.5 mm. Then this is shown. Now, same image we have seen when we are showing you base. Now we are showing you emulsion. Gelatin produced from cattle bones. Disadvantage was the keep silver halides grains well dispersed, prevents clumping of the grains. These are the advantage of the gelatin. Then developing solution can penetrate gelatin rapidly without damaging the structure and the strength. So signal attenuation, the X-ray attenuation will not be there by the gelatin. This is one of a big advantage and easily available in large and uniform quantity anywhere. Now, silver halide for us very important thing. Then light sensitive material in the emulsion. Then its composition 80 to 99% silver bromide and 1 to 10% silver iodide. It increases sensitivity of a film. So we are starting getting with less exposure good films. Then silver iodobromide crystals are precipitated and emulsified in gelatin. Precipitation reaction involves addition of silver nitrate to soluble halide to form a soluble silver halide. The silver iodobromide crystals in the emulsion is in the form of crystal suspended in gelatin. Then crystals are also formed by ions of silver and bromide. We have very briefly seen here how a film in earlier days was used to be. Now the important thing is nowadays though film is not used, we should know how were the earlier films, then how the photographs were produced, then how it's subsequently used in X-ray is interesting to know. With that we are coming to end of the short presentation. I thank you for giving me your valuable time. Thank you, goodbye and take care.